And in 2007, I got a phone call from Massachusetts General Hospital, Wellman Center for Photomedicine, very famous center. Yeah. And Mike Hamlin called me out of the blue, because I didn't know them. Okay. And he said, "I'd like to speak to Margaret Naeser." And I said, "Well, this is Margaret Naeser." And he said, "Margaret, we want to talk to you. You're the only person we can find in the entire VA hospital system who's ever published something on low-level laser therapy." Mm-hmm. And it's in Archives of Physical Medicine and Rehabilitation 2002, because we want to put it on the brain to treat the soldiers coming back from Iraq and Afghanistan. And I was just floored. I was at first very skeptical about what Michael Hamlin told me, that he was sure we could deliver photons into the brain from placing the laser or LED on the scalp. I just was so skeptical, because I was used to treating the arm or the leg with paralysis or pain, as in carpal tunnel syndrome. But I agreed to work with him and put our ideas together, and he was right. And so we did publish our first paper with transcranial light-emitting diodes to improve thinking and cognition in traumatic brain injury. With Anita Saltmarsh, we only had 2 cases, but they both did well. And some of the treatments were done at home. So that was very impressive to me, that you could have this therapy that could be done by the patient, him or herself, in the home. And from then on, we started doing actually a study with 11 traumatic brain injured cases who were being treated at Harvard Medical School at Spaulding Rehabilitation Hospital. And the chief of rehabilitation there, Dr. Ross Zafont, agreed that we would do the work there, because Dr. Michael Hamlin was part of Harvard Medical School, and so I was willing to try that. And we published that paper in 2014. And all of the patients did well. They improved by 1 or 2 standard deviations in executive function, verbal memory. There were 4 cases of the 11 who had PTSD, post-traumatic stress disorder, and they all improved very dramatically. And so we decided to continue on with that. We worked with different pieces of equipment over time, and we're still doing it at the Boston VA Medical Center. And right now we're working with football players, retired professional football players, who might be developing CTE, chronic traumatic encephalopathy. And that was the poster we just presented at this International Brain Injury Association meeting here in Toronto. We've had the opportunity to work with 2 football players, retired professional football players, and do the LED therapies. The first football player is 65 years old when he came to us. And he had played in college football and high school football and Pop Warner football since he was 10. And he was a middle linebacker. And he probably sustained thousands of subconcussive hits, because that's what happens when you play football. And you're a lineman of some sort. So he's a middle linebacker. And he had been diagnosed 4 years earlier, age 61, as having cognitive problems. In fact, he has a PhD. After his football career, he played 1.5 years in the Canadian Football League, and after that he earned a PhD in sports physiology. He's a very smart person. And he taught on the college level, and he was a professor. But after 20 years, he had to go to the high school level to teach, because he was starting to have problems with cognition. And then he had to retire early from the high school teaching level and coaching, because at age 61, he just couldn't even teach in high school level anymore. And he was from the West Coast, but he had come to Boston. He was going to be there for 18 months. And he knew Boston University School of Medicine did a lot of research with chronic traumatic encephalopathy. And he thought, well, that might be the path he's on, is to develop a dementia, and maybe he should try to find out more about it. So eventually he landed in my office at the Boston VA Medical Center. We take non-veterans as well as veterans. And I explained to him the mechanisms of red light and near-infrared light and the effect on the cells, that they can help hypoxic or compromised cells to make more ATP, which is simply adenosine triphosphate. the battery pack for cellular function and respiration of those cells. And he understood that because he had a PhD in sports physiology. And so he listened to me and I explained the mechanisms that we knew about, and he thought that made sense. And he decided he would enroll in our research project. And the other part that he understood was that the reason there was low ATP production in these hypoxic compromised cells is because the mitochondria are clogged up with nitric oxide and they just can't make enough oxygen to function normally, but they're not dead. These cells are not dead. They're just not functioning well. So he agreed to come to our research project. And one other thing to remember about the nitric oxide clogging up the mitochondria is that when the red wavelength of light, you can see that, and when the near infrared wavelength of light, you cannot see that, but when those two different wavelengths, or either one of them, is applied to a cell that's not working well, those are taken in. Those two wavelengths are taken in by the mitochondria. And now, the first thing that happens is the nitric oxide diffuses outside the cell and promotes all this new blood flow and blood vasodilation. It's a wonderful thing. And the mitochondria start to make more ATP. So you get these two wonderful things going on just by applying red and near infrared wavelengths of light. So you're going to get all this new blood flow, and you're going to get all this new ATP energy, and that's going to be what is going to be your mechanism for improvement. So he was very good. He came Monday, Wednesday, Friday to our office for 6 weeks, and we treated him with LEDs all over the head, red and near infrared, all over the head. And then we tested him. 1 week after that 18th treatment, he had done very well. He improved by 2 standard deviations on several cognitive tests. And the thing he was so happy about, and his wife, was his emotional outbursts had gone way down. His PTSD, as it were, post-traumatic stress disorder, was way down. And that was wonderful for him, because otherwise he wasn't able to control those emotional outbursts. So it was very good at 1 week after the last treatment, and even at 1 month after the last treatment. Now, but at 2 months after the last treatment, no LED treatments for 2 months, his symptoms started to come back. Now, that's probably because he may well be on his way to dementia and chronic traumatic encephalopathy that the football players can develop. And we have seen this pattern in another study I did with Anita Saltmarsh here in Toronto with dementia patients. They improved a lot, significantly so, after 12 weeks of treatments with the red and near infrared light applied to the head, and significant improvement. Then they took all the equipment away, and within 4 weeks, they plummeted. So that is a progressive neurodegenerative disease, probably Alzheimer's disease. We only had 5 cases, but they all behave the same way. Now we enter the football players. And here's our football player number 1. And he's going to show me the same pattern. He did great 1 week after the last treatment, 1 month after the last treatment, but by 2 months, no LEDs, no red near infrared light in between, he's plummeting. So that was the end of my study, because I was really officially studying what happened after 3 months. But he decided he was going to buy his own equipment, and he's going to treat at home, because the quote to me was, "I never want to go back the way I was when I first came to you." And he was really very unhappy and looking at a very bad future. So he did that, and he ended up buying this NeuroGamma device that is specifically designed to only treat certain parts of the brain that we finally learned are the most important ones to treat, especially with progressive neurodegenerative disease. Of course, more studies should be done, but this is where we've had success so far. And the light-emitting diode, the near-infrared light, I can turn this on, but there really isn't anything to see because it's near-infrared light. But the red you see is just telling you the electricity's on them. And This device, the NeuroGamma, is actually going to treat basically only 5 parts of the brain. It's going to treat the midline here at the front, at the top of the forehead, called mesial prefrontal cortex. And it's going to treat something towards the back of the head called precuneus. And it's going to treat the left side called supramarginal gyrus here above and behind the ear. And on the right side, the right right angular gyrus, which is superior and posterior to the right ear. So we have mesial prefrontal, precuneus, left and right angular gyrus areas. The 5th area is through the nose to get to actually an indirect way to get to the hippocampus. And we're going to deliver the near-infrared photons, we believe, to right behind the eyebrow. It's the olfactory bulbs where your sense of smell is located. And that area, the olfactory bulbs, has direct neuronal connections to the hippocampus. Everybody knows the hippocampus. It's very important for memory. So it's a little difficult to directly get to the hippocampus because it's very deep in the brain. So we're going there in an indirect manner. And you know, in Alzheimer's disease, one of the first signs of Alzheimer's disease is loss of sense of smell. And that's because the olfactory bulbs, sense of smell, have lost connections down into the hippocampus area and no longer making new neurons, neuronal progenitor cells. The origin for that is in the hippocampal area. So here we have the football players going down after 3 months of no more LED treatments. And then football player number 1 buys his own device and treats at home. So he's treating at home Monday, Wednesday, Friday for 3 months. And then I get all kinds of permissions to retest him and to do another MRI scan. So we did that, and he improved dramatically. It was just as if it was right after the whole head treatments we had done for the 6 weeks at the hospital in my offices. And he can now replicate that at home with this device that's going to treat the most important parts of the brain for cognition. And for even PTSD and emotional outbursts and depression, it's very important in so many areas. And this default mode network, it's called the default mode network, and I always say it's easy to remember the name because by default, they just named it that, the default mode network. Why is it important? Because this anterior or frontal part must be in very good communication with this posterior part, the precuneus. And especially these 2 midline areas, they're very active when you're daydreaming, and they're very active when you're sleeping. Well, you can't do much executive function and thinking and problem solving if these 2 areas are active. You don't do much when you're daydreaming. So, for the brain to work well in terms of thinking and cognition, these areas must downregulate. They must be in coherent communication with each other in a temporal sequence. It's a very slow sequence, a very slow. One cycle can be 16 seconds, but they must be in good communication to downregulate together. Then the sides of the frontal lobes can come up, and you have executive function and thinking, and you can also have good attention. So you're going to get a lot of much better behavior in terms of cognition. Also, the prefrontal cortex here is very important for inhibition, and that will help to control the amygdala in the deep parts of the temporal lobe, the inferior temporal lobe. And I think that's why we also saw a great reduction in the emotional outbursts, and the patients are very grateful for that. So every single one of these LED diodes is very important to treat, and they need to work together in order to really function. And the thing that's really special about this NeuroGamma device is it is pulsed at 40 pulses per second. 40 pulses per second. Why is that? Because there was a study done at MIT Iacarino et al., 2016, published in Nature, which showed that with mice who were genetically engineered to have Alzheimer's disease, when those mice were placed in a dark room in a plastic box, and all they could do is stare straight ahead, and a light was shown through the eyes at 40 pulses per second on that light. Now, 1 hour a day, 7 days a week. And then you sacrifice the mouse and you look in the brain and you want to see if anything happened. Well, did they decrease beta amyloid, which is an abnormal protein deposit observed in Alzheimer's disease, or tau, tau, another abnormal protein deposit seen in Alzheimer's disease. And when they looked at the back of the brain in the visual cortex, they observed a 60% reduction in beta amyloid and a 40% reduction in tau. But they only got that reduction when the light was pulsed at 40 pulses per second. And that particular pulse rate activated the microglia and their phagocytosis effect, meaning that they could sweep up and take away abnormal proteins, because the phagocytosis effect could do that. And that's their mechanism. Now, that was an animal study with mice with genetically engineered Alzheimer's disease, but they were able to see that that particular pulse rate would be helpful for that. So the V-Light neurogamma here is actually pulsed at 40 pulses per second. Your eye can't see that. That's way too fast for your eye to see. But if you were to ask me if I wanted to make a hypothesis of what we think we're doing with using this device on the head with the football players who going downhill and having dementia problems, but did really well when we delivered the helmet all over the head, I think that we could possibly be reducing tau. And that's extremely important because that's the main problem with CTE, chronic traumatic encephalopathy. It is a different form of tau than in Alzheimer's disease, but there's many types of tau. However, that's a possibility that could be part of why we're seeing this football player, the first football player, number one, not only purchased his own device, and we documented that he had done so much better after 3 months of treatment at home. We're still in touch with him, and 10 months later, he's doing very well. Now, if he hadn't started doing this treatment, even if it's placebo or what, he would not be doing better. He'd probably be doing worse after 10 months. So he's very enthusiastic about his results, and he does keep in touch with us. But not only because of the 40 pulses per second, we're probably pulling some tau out through the phagocytosis effect from the microglia, but we're probably also getting back together the default mode network, because we're allowing more photons to come in here as well as here. And this particular placement here, the mesial prefrontal cortex, is the most important part of the brain that needs glucose. It's the most demanding part of the brain. It's this cortical area that is just requires a lot of energy and glucose to function. And if you think about what happens in football, this part of the brain is going out there and getting hit all the time. Even if it's got a helmet on the head, this is bang, bang, bang against this mesial prefrontal cortex. So no wonder that's getting set up for abnormal default mode network function. And if we can get that back on track, that is a very good idea. And 2 years ago, they discovered that the brain has its own lymphatics drainage system. And the main part is right here in the midline. And these tiny little lymphatics vessels, they are about a millimeter in diameter. They're very tiny, and they're in this leathery protection for the brain called the dura mater. No wonder they didn't see them before. And again, they're right along this mid-sagittal area, or the midline of the brain, as we would say. And it's very possible that when you play football, bang, 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 you're also damaging the lymphatics drainage system. And if that's damaged, you're going to have buildup of beta amyloid and buildup of tau. All these abnormal protein deposits have no place to go. They can't get out the lymphatic system. And the other issue is sleep. These football players are like traumatic brain injured players. They all come complaining they can't sleep. And even the Alzheimer's patients especially complain they can't sleep. Well, if you can't drain out your abnormal protein deposits, beta amyloid and tau, for whatever reason in your lymphatic system, it's just not working, you're just not going to make progress forward. You're going to get worse because you normally would be getting rid of the beta amyloid and tau when you sleep. That's just the way it is. You can go online and you can look at beautiful movies showing how once you go to sleep, and then animals and so on, that during sleep, the vessels are massaged to bring out the abnormal protein deposits. But if you're not sleeping, you can't bring it out. And all the Alzheimer's disease patients complain endlessly they can't sleep. So this is vicious cycle, and the football players too, because I suspect that this lymphatic drainage system is just not working properly. But we can dilate that with the LEDs in the red and near infrared wavelengths, because there's a lot of studies from Australia where women who had breast cancer and they removed the breast and they get terrible lymphatics swelling, they get lymphedema post-surgery, and they can go on and on. But mostly in Australia, they use scanning, red, near-infrared light, or even laser. Also, they can do red or near-infrared, and they can scan to promote lymphatic drainage. And this is what I would think we can be doing with our LED applications on the midline of the head especially. And then the patients improve in sleep because we're increasing melatonin. There's a lot of studies that are done that particularly the red wavelengths, but near infrared also, will increase melatonin. And so that's probably just another wonderful side effect of all of this, that the wavelength will help with sleep. And all the patients come back to us saying, oh, thank you, I'm finally able to sleep. And that's one thing that they have also noticed.